that we've been experiencing. So today we'll be talking about your kidneys and how you can actually flush out, how you can actually crush, dissolve and flush out kidney stones without side effects. I am Onovo Victory, and I'm your kidney health coach, and I'll be giving it to you the way and the exact thing that you actually need in order to do what? To become free from kidney stones. Okay, why am I doing this? I'm doing this because I am a kidney health coach. I work in a dialysis unit. I work in a renal center where we have a lot of people come down with kidney issues because of things that are actually what? Preventable. Okay, so these things are actually preventable, and a lot of persons are actually developing it on daily basis. So I said, okay, because of this condition, let me come up and talk to my people and talk to our people and save as much persons that I can save at a time. Okay, so that is that for that. So I'm Onovo Victory, you've known me. So today we'll be talking about flushing, crushing, dissolving and flushing kidney stones. And in the next few minutes, this is how I have actually used to help people, so many people, become stone free. So I'm going to be giving you this strategy. The strategy is actually, we have the two-step strategy that involves medical treatment. Then we have our 4 cardinal points in that we actually use in the treatment. So if you listen very carefully, at the end of this presentation, you should be able to hit your chest and say that you've gotten all that you need in treating what? Kidney stone. In fact, what we are actually doing here is a do-it-yourself approach, but I'm going to be around to actually guide you on what you need to do and how you need to go about it. Now, what is kidney? A lot of us, before our diagnosis, most of us have been diagnosed. Before our diagnosis, we don't actually pay close attention to what the kidney is and actually what the kidneys do. So, but before we go to talk about the cure or the treatment, how you as a person can actually dissolve and flush out kidney stones, so I want us to go through what the kidney is and what the kidney does. Okay, so the kidney is actually a bean shaped organ located at behind our back, like how do I explain it in the layman's understanding? Okay, located behind our peritoneum. Okay, so it is easily accessed from the back. So a normal human being is actually born with 2 kidneys, even though life can be sustained with 1 viable kidney. Okay, some people are actually born with just 1 kidney. So in that case, it's called renal agenesis, where someone is born with just 1 kidney. So we have we have other renal condition where some people are, then they gave birth to them, they don't have any kidneys at all. So we have other cases where they gave birth to some people, their kidneys we have what we call ectopic kidneys. They are not located in the position where the kidney is supposed to be located. Okay, so we have what we call the horseshoe kidneys, the 2 kidneys joining together, and a whole lot of conditions that affect kidneys from birth. And most of these conditions, if not properly detected on time and not properly handled, can actually affect this person's life. So now we've agreed that we have a normal human being is supposed to have what? 2 kidneys. Okay, so and we've also established the fact that 1 kidney can actually do what? That is 1 kidney that is viable can actually take someone throughout life. Okay, having said that, we've also agreed that the kidney also has the shape of a beans and it is easily accessed from the back. So having said this, we now proceed to the functions of the kidney. The kidney has various functions. The truth is that understanding these various functions of the kidney is going to help us in knowing why people develop kidney stones. Okay, one of the key functions of the kidney is to remove excess fluid from the body. So because many people do not take enough fluid, they do not take enough water, many of them develop kidney stones. Okay, now another very important function of the kidney is that the kidney also is key in removing waste product from the body. And because of most people they do not take enough water, and they take a lot of junks, and these waste products accumulate in their body, and by the time it accumulates in their body, it begins to form waste. So that is where you have another kind of stones forming in this person. So the kidney also plays a very important role in controlling blood pressure and blood level. Okay, so we can go on and mention the functions of the kidney. So now that we've actually known the function of the kidney, it is also very important for us to talk about um, what kidney stone is. So now, what is kidney stone? Kidney stone actually forms when waste products um, begins to solidify in the body. So it's actually a solid mass that forms in the kidney, either due to excess waste in the body, or due to someone not taking enough water, not taking enough fluid. So this stone solidifies, forming a hard mass. That is why it gets the name what? Kidney stone. So now, having established what kidney stone is, so kidney stone is actually like a physical stone. Maybe in our next class, I'll actually bring a physical kidney stone that you can actually see and know that this is actually what kidney stone actually looks like. It's very, very hard as what? As a stone. Okay, so having said that, we have four different types of kidney stone. We have four different kinds of kidney stone. We have the one we call calcium stone. This calcium stone is by far the highest, the most occurring stones that we have. Okay, we have different kind of kidney stones, but this calcium stone forms majority of the stones. So if you're in the hospital and you are seeing kidney stone patients, most of these patients would either have what we call calcium stone. Calcium stone occurs when you have excess calcium in the body. What did I say? Calcium stone happens when you have what? Excess calcium. So excess calcium in the body actually leads people to developing calcium stones. And some will say, because of I'm having calcium stone, I'll stop sourcing my calcium from natural this thing. I'll stop anything that contains calcium. The truth is that for you to have calcium stone, you have a higher increase of getting calcium stone if you take supplements that contains calcium. So that is the major way these things can happen. So natural stones, their ability to cause calcium stone is not as much as when you take what? Supplement. So if you're here, you're listening to me, and you're in the habit of taking supplements, especially supplements that contains calcium, it could be a pointer that you're having that what you're having is either kidney stone, and the stone calcium stone, and the stone you're having is highly predisposed by what? By the supplements you're taking. Then one thing about calcium stone is that calcium stones, they are usually very hard. Other type of stone may actually do what? Dissolve in the long run, but you see calcium stone, it's very, very difficult, or it is not possible for them to do what? For them to dissolve. What a calcium stone can actually do is that a calcium stone will do what? You can actually flush it out, but when it comes to dissolving, you may not really be able to dissolve what? Calcium stone. So the topic of our conversation today is how you can actually crush, dissolve, and flush out kidney stones. So for calcium stone, you cannot, as it is in the stomach, you cannot dissolve it. You can either flush it, or you do what? You crush it. Somebody will be asking me, how do you crush calcium stone? The only way to crush calcium stone is through what? Surgery, what we call laser lithotripsy. So, and you can flush it too. That means by the time you take the medications you're supposed to take, that I'll be listing later in this webinar, and you take adequate amount of water and regulate your diet, and also do the exercise that you're supposed to do for kidney stone, you will also be what? Be in position to flush out what? Kidney stone. So now we've talked about calcium stone. The next stone we're talking about is the uric acid stone. So uric acid stone is a kind of stone that actually forms when you have a buildup of uric acid. Uric acid is actually a waste product of protein metabolism. So like there are certain proteins that when you eat a lot of them, you actually do what? It can actually lead you to developing what we know today as what? As uric acid stone. Then we have the struvite stone. So struvite stone is actually gotten when someone is actually developed when someone has repeated episodes of UTI. So if you hear you keep having UTI, you keep having UTI, the kind of kidney stone you're going to have is struvite stones. And struvite stone, it can actually go larger easily. So struvite stone can actually do what? Get larger easily. You can see a struvite stone of 2 mm maybe to them today, and in the next few weeks it would have grown from 2 mm to 10 mm. And some who has calcium stone, the stone may just have increased by 1 cm, while that of someone who has a struvite stone would have gone far to as much as 10 mm. So but this differs from individuals to individual. I just gave this example so that I'll be able to do what? To portray my point. So now we have the cystine stone. Cystine stone actually occurs when someone has a disorder of cystinuria. Okay, so this makes this person's body prone to do what? To developing these kind of stones. So now we've talked about different kind of stones, and we've actually talked about how you can actually, as we're talking, I think I mentioned how you can actually handle some of them. I told you that some stones cannot be dissolved. Okay, that is either you flush them or you do what? You crush them, or sometimes you need to apply both strategy. Then I told you that there's a medication I actually give to people who have kidney stones that helps them to become what? To flush out kidney stone. Then I tell you that I don't just do that. I have 4 other approaches that you need to follow if you actually want to flush out kidney stones. So if you're following me from outside the country, I want you to also pay close attention to what I'm going to be saying, because the meals that we are going to be using is actually a universal meal that you can actually access wherever you are. And the ones you're going to avoid, okay, both locally, those in Nigeria, is the same thing. Just basically the principle is the same thing. It can work for you no matter where you are on planet Earth. So now we have we're talking about what are you going to see in your body for you to know that what you are actually having is kidney stone. One of the primary things you notice in your body, and you know that it's kidney stone, is lower back pain. That is why you will discover that when the video I did to talk about this webinar on Facebook was actually talking about lower back pain. So now we have different pain points at the back, different points where people feel pain. So when you feel pain at any of those pain points, it could actually mean different things. But that of lower back, you know, the position of the kidney, that of the lower back is actually a pointer that someone is having what? Kidney stone. But kidney stone actually is not the only condition that can actually make you to have what? Lower back pain. So most of us came here today because we are having lower back pain, and maybe because of the things we've had online, we feel that what we are having is what? Is kidney stone, and that is why you're here. I want to tell you that we also have kidney cysts, which can also make someone to have what? Lower back pain. We also have kidney infection. We also have a lot of other health conditions that can actually make someone to have lower back pain. Apart from issues that actually have to do with the kidneys, we also, just give me a little time. Okay, so apart from that, someone who is having issues with the ovary, or who is having a lady who is having STD, or a guy who is having urinary tract infection, may also have these things I'm talking about to battle with. This person may also have lower back pain to battle with. So we have the one we call the call the upper back pain. Upper back pain happens when you are having when you have things like cholecystitis, issues that has to do with liver, fatty liver, hepatomegaly, and the rest of them. So these are the things that can actually make someone to actually have upper back pain. So I have a video I did on my YouTube channel, the channel where you're watching this program on this evening. I have a video where I dedicated to talking about everything about back pain. So if you're interested in watching that video, after now I will be posting it in the group so that you can actually take out time to look at those pain points and actually see what it is, so that you'll be able to have an understanding of what is happening in your health and how you can actually seek proper medical attention and remedy it. One of the reasons why it is actually good for you to have idea about your health is that it could actually be a lifesaver for you. It could actually help your medical doctor, help your health personnel, for you to be able to direct them aright when they're actually doing intervention that could actually save you. So apart from lower back pain, someone who have kidney stone may experience now saying vomiting and the feeling of wanting to vomit. Then this person may also experience pain while urinating. So, and this person may also experience frequency in urination, especially urinating at night. A lot of persons in this group, I was going through the reasons why you join this group. Most of them say they urinate frequently at night. There are things that can actually make you to urinate frequently at night, aside kidney stone. Kidney infection, anything affecting the kidney can actually trigger that. When prostate issues can actually cause this. Diabetes and a lot of other sicknesses can actually mimic without going for proper consultation. They just go ahead and do what? And start treatment. This is actually a very bad way to treat yourself. Look at, you've seen the things I've listed now. You may actually be thinking that it is A that is wrong with you, while the main thing that is actually wrong with you is B. So what consultation does is that with proper consultation, your doctor asks you certain questions, or your health care person asks you certain questions about your health, and the answer you give directs this person to the necessary investigation they are supposed to go for. And by the time you go for those investigations, the results will be used to do what? To treat you. But by the time you try to assume things by yourself, so many of us will go on the internet. Apart from listening to webinars like this, we read a lot of things from Google, and we are diagnosing ourselves, and we are buying so many herbal teas online that is not working. I know of some persons that have gotten a lot of different herbal teas, different herbal sprays for kidney stone. After taking it, the pain kept increasing, and by the time they get to know what they are doing, it has actually gotten too late. But that's not going to be your portion, because it is actually timely that you are listening to me at this point and you're going to do what? Take action. At the end of this teaching today, I'll be having time for what? For consultation, and I pray and I want you to be part of what? Of that consultation. Now, there's another thing I also want you to pay attention. Apart from the frequent urination, when you're having kidney stone, you can also do what? It can also have cause you to be having repeated attacks of fever. I know of a friend of mine, a patient too, who is in Sangota, Ogun State, who has this kidney stone, and his own comes with very, very high fever. Because when we're talking about why is this person actually having high fever, and the high fever is something else, so they have to admit him in the hospital to be able to do what? To tackle that high fever. Now, if you are having all these signs and symptoms I've talked about, in fact, I have a book where it's actually, you have in form of ebook. It's also available on Amazon and on Seller. I also have it in my phone. Okay, for those of you that have been needing that ebook, it's going to be a guide to you that is going to help you to know how to navigate about your treatment. So I just wrote about only 5 signs and symptoms of kidney stone here. So in that place, I wrote a lot of them. In fact, that book is just like having your doctor write with you when you have kidney stone. So now we look at tests that you can do to confirm that someone has kidney stone. One of the tests you need to do if you're having lower back pain and you feel that what you're having is kidney stone, one of the tests that you need to do to confirm that is what? Ultrasound scan. How many of us have gone for ultrasound scan here? If you've done your ultrasound scan, I want you to write on the comment section, I have my ultrasound scan. Okay, or you can also post that in the group so that we proceed with what we are doing, so that we can actually have a proper interaction. Okay, so now we have the urine culture test. Urine culture test now shows if this person has what we call what? Infection. So at this point, I want to make it clear that kidney stone can actually make someone to develop a urinary tract infection. A urinary tract infection can actually make someone to develop what? Kidney stone. So now, the chief of the investigation that you can actually do to know if you have kidney stone, because ultrasound may fail, and every other thing, signs and symptoms may fail. But one thing that medical doctors, one thing that have been generally accepted as a yardstick in medicine is the ultrasound scan. So even there is a level your stone will get to, I will advise you to go for ultrasound scan to actually note the size of the stone. Because when it comes to stone management, there are things that we look at. We look at for what is the position of the stone, where is the position of the stone, where is this stone that this person is having, where is it located. By the time we've answered that question, we'll also be answering the question, what is the size of the stone? So if you have a stone that is located at the upper pole, or located at the middle pole, or located at the lower pole, so we have different treatment approach for these stones. So by the time you have a stone that is less than 10 mm or that is higher than 10 mm, they have different treatment approach. I actually tell people, if your stone is more than 10 mm, or 10 mm and above, I usually advise my clients or people coming to kidney health class to do what? To look for a way, save up money, and do laser lithotripsy surgery. If you go through this my group, you discover you see videos of where we actually did in our sister hospital, where we did kidney stone surgeries using laser lithotripsy that is actually successful. So now we've talked about the treatment plan, we've talked about all those things, and when your stone is actually at the lower pole, so if you're going for a scan, I want to talk about this in this secret. I don't usually talk about it in my other classes, but I want us to know this. If you're going for a scan and your sonographer or your radiographer is doing the ultrasound scan for you, okay, I want you to ask the ultrasound person, where is this stone located? Is it in the upper pole, or in the middle pole, or in the lower pole? Now let me tell you the reason why it's very important for you to note the pole where the stone is. Upper pole stone, middle pole stone, they are easy to pass, but lower pole stone are usually difficult to pass because they will have to go against gravity. So if your sonographer can't tell you the size of the stone and they can't tell you the position of the stone, my brother, my sister, please, you can actually look for a better place to do your procedure. Okay, so in this place I am now, we have a center where we do basically ultrasound scan. This is because of the discrepancies we've seen over the years about ultrasound results. So because we want patients to actually have the best of the results, we have our own latest ultrasound scan machine that you can actually use. In fact, you will see the thing clearly with our machine, and you'll be able to tell you the size and the position of this stone. So now, before we talk about the treatment, let's look at the complications, that because we are almost running out of time. Let's look at the complications. If you don't treat kidney stone, look at what's going to happen. One, I know a lot of people that certain persons have asked them to be drinking water. I don't want to call doctors, but I just want to say certain persons have actually asked them to be drinking water when they have kidney stones. I want to tell you that drinking water alone cannot flush out kidney stones. Okay, I've also seen it in the group where people were talking about it in this group here, that they are drinking water. Drinking water alone cannot flush out kidney stones. Okay, so one of the complications, if you don't treat kidney stone, if you don't treat it, tackle it head on, kidney stone is not malaria. It requires a lot of attention and discipline for you to be able to do what? To flush out kidney stone. So when you don't treat kidney stone, the stone increases. Apart from increases, the pain increases, and there's also risk of you having infection. Then there's also risk of this stone becoming so large that it obstructs the flow of urine. Aside of obstructing the flow of urine, it can also cause what we call hydronephrosis, fluid in the kidney. It can also, when these conditions are not properly managed, they can actually affect the kidneys. Now I want you to listen very, very carefully, because I'm now talking about what you can do to actually treat kidney stones. I know that's the reason why most of us came for this webinar this evening. How can you successfully treat or handle kidney stone? One of the ways you're going to be treating kidney stone is choosing water therapy. So remember what I'm saying. Water alone cannot flush kidney stone, but water is an important part or an important aspect of doing of treating kidney stones. So now let's go over it. So now, how much water should you drink? The amount of water you should drink depends on where you are and the nature of your body. Okay, so basically, people in Nigeria, because of the place where we are, very hot climate and all the rest of them, I usually advise them to do 5 liters of water every day if you are treating kidney stones. Okay, you do that for one month. You can actually reduce based on how it's impacting your health, based on continuous review. So by the time you're doing this, you're taking in enough water, you're increasing the amount of urine flow through your kidneys per time. As this happens, it will be able to do what? Flush out what? Kidney stones. Then we have exercise. You can't be treating kidney stone and you're drinking only water and you're not including exercise. Exercise is actually an integral part of kidney stone treatment. And when you're treating kidney stone, you don't just do anyhow exercise. We have like I told you, I have a book where I wrote about your treatment of what? Of kidney stones. Okay, so in this book I have here, okay, you can actually, I talked about the kind of exercise that you actually do to be able to do what? To flush out kidney stones. Not all exercise works for kidney stone. What am I saying? I said not all exercise work for kidney stone. So in this book, I have written out the exercises that you need to do. In fact, when you're treating kidney stone, it is very important that you have this book close to you. You have this book handy so that it will be a guide for you, because in this book we talked about both the drugs that you're going to be taking, the what do they call it? The exercise you need to do, the diet, the amount of water you're going to be taking, and everything that is actually required. This book is just like arming you to go to the war front and defeat kidney stones. So, having said that, we talked about both the diet. Then we have a lot of diets, but I'm going to mention one. So, and when you're treating kidney stone, you need to avoid diets that are high in oxalates, because oxalates usually attach itself with calcium, giving rise to calcium oxalate that is actually chief in causing what? Calcium stones and variety of other type of stones. So one of the food that if you're treating kidney stone you need to cut down on or stop drastically is granules. So if you have kidney stone, you're eating granules, you're wrong. So it's one of the these things that you need to remove from your diet. And the rest of these things that you need, I've actually written them out in this book, and it's going to be a perfect guide for you. So now we talk about drugs. You can't be talking about the treatment of kidney stone without talking about drugs. So in this teaching, in this live video, I'll be talking about only flow mass. Okay, by the time you get the book and you come for consultation, I will tell you other supplements that you can actually use to actually bring down what kidney stone, and you become totally free from kidney stone. So like I told you, when the stone is more than 10 mm, the best approach I recommend is laser surgery, is surgical removal of kidney stones. So we talk about flow mass, and flow mass, what flow mass does for you is that flow mass dilates the walls of the ureters, and by the time you're taking enough water, it helps these things to actually pass. Okay, and as you're treating this thing, there's also high chance that these stones will form back. So that is why you need to be eating the right food, and the right food that you need to eat, I have documented it in this book that I've actually shown you, and it's going to actually do what? To help you. Now, on the final note, before we wrap it up and continue our conversation, I would like to take your questions. I would like to take questions. So if you're unable to type your questions on the comment section here, I also want you to, in our WhatsApp group, I want you to go there and do what? Drop your questions. I'll be tackling the questions one after the other. But during that period, please, I wouldn't want you to share your medical reports on the group, and I wouldn't want you to do voice notes on the group, so I will be able to attend to everybody. I'll be leaving the group open, okay? I'll be leaving the group open, so I'm not going to close it. So we'll be able to do what? Align and do what? Sit proper position. So now, on the final note, our treatment strategy has 2 steps. Okay, someone is asking where can I get the book. The book is on Amazon. The book is on Seller. The book is also with me here. I can do a waybill to you no matter where you are. Then if you're outside the country, you can buy directly from Amazon.
okay, for $15 from Amazon if you're outside if you're outside Nigeria. Okay, so and if you're outside Nigeria, you can also buy from seller. Okay, you can also buy from seller, and it's 7,500 naira in seller. But I'm going to talk more about that later. So now we have a two-step treatment strategy that you can actually use. So we have the one you use in preparing your body, and the one that after preparing your body for the treatment, you now go over to this treatment strategy that will carry you for 6 months, for 6 weeks. Okay, so treatment of kidney stone is not treatment of malaria that will go after 3 days. It's something that is actually a prolonged treatment that needs consistency, that needs discipline, that needs resilience. Okay, so now after this presentation, I will need to have a one-on-one consultation with you, because no two kidney stones are the same. Okay, I know that I've given you a lot of pointer to what you can actually do, but having a one-on-one conversation with me would actually be a clear way that to gain the coaching that you are here for. Because the truth of the matter is that I've saved your number, and I want you to save my own number. I want us to work through a treatment plan that will actually guarantee you that you pass kidney stones. Okay, some of us need someone to hold them accountable. So I have this coaching section that you need to buy into. Okay, where I will be directing you, where I will be answering your questions, where I will be I'll be following you up, where I can actually recommend things that can actually work for you. This is the internet space. I may not really be able to mention everything on the internet space, but by the time I work with you one-on-one, we'll be able to profess perfect solution that will actually work for you. Most people have kidney stone, but they have other conditions attached to the kidney stone. Okay, some people have both kidney stone and kidney cyst. So some people have polycystic kidney, and they actually also need care. Some people have kidney infection and they need care. They want to talk to me. So during this consultation period, we will now have time to do what? To talk about a lot of things about you. And this is a one-time payment that when you pay this money, when you get the coaching section, you're not going to be paying any other money to me. Okay, so now this is how it works. I charge for consultation, and that consultation, like the coaching section. Okay, so that coaching section, I charge for it. Normally our book, and what I charge for is not that you're going to pay for it. Once you buy this book, it qualifies you to be part of the coaching section. And apart from that, you also get on the first book I wrote on kidney health. You also get it for free. You're getting that one, the ebook. You're getting the ebook for free. So if you want this one, if you want hard copy anywhere in Nigeria, I can send it to you. But you may actually need to pay something for the delivery, additional money for the delivery. So now, apart from this, I also have a smoothie recipe that I can give you. Remember I talk about cleansing. I have a smoothie recipe that I give to people before they start the treatment that can actually help them to do what? To flush their kidneys, okay? To remove waste from their kidneys. So this is how I work. I'm Monovoy Victory, and I'm your kidney health coach. I've been practicing this for almost a decade, and I believe that if we work together, you will actually get your perfect healing. So now we are going to be ending this section here. I'll be going to WhatsApp to continue our conversation. In fact, it's very, very amazing in this place. Chinyere, Alechi, Abdulkabi, Choma, I'm very, very happy for your response, for everyone who have joined. I want to say thank you so much, and I am very, very grateful. I am Monover Victory, and I'll be very, very glad for us to walk this path. Thank you so much. God bless you.